Good evening, everyone, and welcome to the COVID-19 What Now event. This is a big welcome from us, the three directors of public health for Bristol, North Somerset and South Gloucestershire. My name is Matt Lenny. I'm Director of Public Health in North Somerset, and I'll hand over to my two colleagues to introduce themselves. So maybe Christina, if I come to you first.
Hello, everybody. I'm Christina Gray, and I'm the Director for Communities and Public Health in Bristol.
And then across to Sarah.
Hi all, I'm Sarah Blackmore, Director of Public Health at South Gloucestershire Council.
So the aim of the event this evening is to give you a bit of open access to us. We've been working with our community for a number of months now, trying to protect and improve the health of our local population. And thank you to everyone who's worked so hard to manage the different waves of the coronavirus as they've come through, all the responsible actions that you've taken. And hopefully today is a bit of a roundup of where we are now and the last things that we need to be doing to try and manage this pandemic well. So perhaps if we go across to some of the questions. So we have an online system. If you visit sli.do, Slido, and then put in COVID what now in the subject heading, that will take you to a series of questions. You can input your own question there, and we've had a few come through already, or indeed you can like the questions that you think most represent the viewpoint that you would like to put forward. And what we'll do is we'll pass those questions around between us and answer them as best we can, and maybe also add additional information and support each other in that process. So I'll move on to the first question, which is quite a common one, which is, I've had both vaccines. Why do I still need to wear a mask? Maybe Christina, if I could come to you first to help to answer that one. Thank you.
Thanks, Matt. Very interesting question. Thank you for that. The importance of both having a vaccine and wearing your mask is as much about protecting other people as it is about protecting yourself. And at the moment, particularly at the moment where we're seeing this sharp increase in infection, there is a lot of the virus still circulating, and we have quite a substantial proportion of the population who have not yet been vaccinated. The vaccines themselves are providing a very good shield against the current virus, but no vaccines are 100% safe. So really, until we're through the next few months, it's important to still keep covering your face. Thank you.
Great, thanks, Christina. Sarah, I don't know if there's anything you wanted to add to that in terms of any other points?
No, that was helpful, thanks.
Yeah, and I think it's also important to remember that the mask is not the only thing that you can do. So it's also about those messages about day-to-day hygiene approaches as well. And of course, the use of physical space and fresh air as protective factors as well. So all of these things work together and they help to keep us safe. So I'll come across the next question. And Sarah, maybe if I could come to you on this one, which is what happens when everyone is vaccinated? That's a question that's come in from a member of the public.
So another good question, thank you for that. I think what's really important is to keep the longer term in mind actually when we're talking about vaccination. So although of course we're aiming now for this first tranche of people to be vaccinated, it's really important for us to think about the fact that it's highly likely we will be living with COVID for a long time, and therefore there may well be future vaccine programs for us to consider in the autumn, for example. So really important for us to think about that going forward, as well as clearly us all aiming to get across the line and ensure that all of us are vaccinated in line with the rollout.
That's brilliant. Thank you, Sarah. Really helpful. So coming on to the next question, which has a specific ask about Bristol, but I think this probably covers all of us, but maybe if I come to you, Christina, which is asking, will Bristol require face coverings in schools now the new variant is on the rise? And in the longer term, will there be investment in ventilation in Bristol schools? I think that applies to all of us, but maybe if you want to say something from a Bristol perspective and we can come into.
Thank you. And thank you for that question. A number of people have actually sent that in to me directly. It's important to understand that schools are accountable directly to the Department for Education in terms of their guidance. So we as Directors of Public Health don't have a direct role in that. We have a role in supporting the schools in responding to that guidance and in having a dialogue with the DfE in terms of our situation, but the national guidance from the Department for Education to schools is that face coverings are not required in schools. What we do have locally in a number of our areas is where there's a school that has a particular outbreak or cluster, the school, in conjunction with Public Health England and ourselves, can take a decision to reinstigate mask wearing for a short time while the outbreak is controlled. And the second question, that was about ventilation.
Yeah.
Again, this is something that would sit with the schools, the academy trusts and the Department for Education. It's certainly the case that what we have learned is that ventilation, indoor ventilation and outside space is extremely important, and I'm sure that schools, along with other institutions, will be looking at this going forwards. I wouldn't see that the local authority would have a direct role in funding that, but we would certainly be engaged through our Directors for Education in engaging in those discussions.
Thank you, Christina. Just checking, Sarah, is there anything additional you want to say from a South Gloss perspective?
Yeah, I think just picking up on the masks aspect in schools, just to highlight really that these decisions are never taken lightly if we do need to introduce the wearing of face masks in schools, because we do appreciate that it's not ideal for children and staff. That said, we review the situations regularly, and as Christina has said, if there are outbreaks and the assessment of risk is such that we need to reintroduce masks, we will do so, but clearly look to move back to the standard position as soon as we can.
Thanks, Sarah. Yeah, that's a really important point. And I suppose anything that I'd say in conjunction with that, absolutely agree with the answers given so far. It's maybe a good opportunity for us to say thank you to our schools for the amazing work that they've done throughout this pandemic. They really have worked so hard and so well with us in trying to manage the situation that we've all had to work through. And throughout that time, they've been very responsive. They've worked with us at Public Health England. They've adapted to new guidance. They've adapted to new guidance from the Department for Education. So this is always a changing picture. But what we do have is really good lines of communication with our schools, and we work very collaboratively to try and do the right thing at the right time. So, and we'll continue to do that in the future, no matter where we go with the pandemic next. So thank you to our schools. It's worth saying that, I think. So just moving on to the next question, which maybe I'll start with, and then if colleagues want to come in. So it's asking about whether there's a need to take rapid tests after you've had vaccination. So probably importantly in that first question, I presume that's about after a second vaccination, when you've had the maximum dose that you can have. Well, there are different regimes in that. And of course, we have different settings where we've had routine testing despite people having 2 vaccinations. So for example, some of our more vulnerable settings, our healthcare settings, our care settings, there will be different regimes because, as we said earlier, vaccination is a really good form of protection, but it is not an absolute guarantee that the virus can't circulate, particularly amongst those more vulnerable populations. So it will depend a little bit on where you are, but the advice at the moment is definitely in this position that we're in at the moment, everybody should keep doing regular testing. That way, we can identify the virus as quickly as possible. We can understand those cases. We can trace around those cases to work out who the contacts are, and we can limit the spread as quickly as possible. And that's why testing is a really important part of the approach alongside the vaccination. So it's not one or other, it's using things in combination alongside all the other measures that we might look at as well. So I'll maybe start there, but if colleagues want to say a bit more around that, happy to open it up.
No, that was a good answer. Thanks, Matt.
Great. Okay, thank you very much.
I'd just like to sort of underline that, Matt, that testing has been so important, is so important for us in Bristol. And the fact that we can see the cases that we can see means that we can see the virus and we can contain it. So really just a huge thank you to everybody, because our testing rates have not dropped off in spite of the fact that I'm sure many people are quite tired of this. The lateral flow tests have been really, really helpful with this wave, because a lot of what we have picked up has been asymptomatic transmission amongst younger people. So yeah, stay with the programme, people. It's hard work, I know, but I think we just need to get through the rest of this year, and testing is just hugely helpful.
Yeah, thanks, Christina. Really good point. It's been a really good tool for us all the way through. So maybe I'll come back across, Christine, maybe if you'd like to start on this one. So it's asking a question about, are there any plans to remove testing sites locally? Statement there saying it's good to have testing sites on hand to reassure or prevent exposure. So slightly different angle on the testing. Yeah.
Yeah, absolutely. So I'll speak for Bristol, and then Matt and Sarah can talk. We've got slightly different geographies, obviously. So in Bristol, we have aimed to have local testing sites, north, south, central, east and west, so that people can get to them easily. And they've been really important for us in being able to enable people to get tests easily, and have helped us manage when we've had the surges and peaks and waves. In terms of the lateral flow tests, we are keeping one lateral flow, the rapid asymptomatic testing centre, open. It's open 7 days a week at the bottom of the M32. It's in the old Staples building. If you remember that, as you come into Bristol on the M32, you come into Bristol, it's on the left. That's open 7 days a week, and you can go there to take a test or pick up lateral flow tests, which you can also get from pharmacies or by post. So yeah, certainly as DPH, I've got no intention of suggesting that our local testing centres are dismantled, but they are run by and provided by the Department of Health and Social Care, so it's not entirely within our gift.
Okay, Sarah, would you like to come in on the back of that? Anything for your end?
Yeah. Thanks, Matt. Thanks, Christina. I think what's really important to emphasise again is the importance of regular testing, absolutely, alongside vaccination and everything we've already talked about in terms of hands, face, base. Now, in relation to South Gloucestershire, we have access for our residents for PCR testing, so the mobile testing units, etc., that people will be well aware of by now. And we also have in place our community testing offer, so the lateral flow testing, rapid testing that Christine has referred to already as well. So in South Gloucestershire, you will now see a bright pink van, which enables people to access a mobile offer for these lateral flow tests. So people can come along and test at the van or pick up a test and take it home. And of course, there's the online offer and also pharmacies for accessing tests too. And that's pretty consistent, I think, across all three areas. Perhaps not the pink van, but certainly in terms of ease of access to lateral flow testing, which, as I say, is just so important in terms of testing twice a week and helping us move forward.
Thank you, Sarah. Yes, I think our van in North Somerset is a slightly more mundane blue, so you'll see it, but it won't catch your eye in quite the same way. So yeah, absolutely the same for us. It's been helpful to adapt as we've gone along with testing. We've learned as we've gone along about what actually helps to find cases, what's the best use of our resources in terms of trying to use those to maximum effect. So we have adapted in terms of more mobile solutions around testing, but also I think the introduction of the lateral flow tests ordered to your home and through pharmacies is quite a good revelation. I suppose the one thing I would always emphasize is if you do a test, please do report those results on the lateral flow, because even if it's a negative and you think, well, no one needs to know it's a negative, it really helps us understand what's going on, and perhaps where there are cases and there aren't cases is a really good bit of intelligence for us to plan how we help to try and control the spread. So that's just my one plea on the testing front for tonight. Okay, so next question, maybe Sarah, if I could come to you on this one, which is saying clearly masks and staying apart is the way to stop the spread, but what about the precautions with wiping down shopping? I presume that means shopping trolleys, phones, keys, washing clothes, etc. Where are we now on that, and how does that work alongside those other measures?
Thank you, and that's a really good question. Certainly at the start of the pandemic, there was a big push for that, so I can understand where you're coming from with the question. I think what's really important to highlight is ongoing personal hygiene and common sense, really. So I think it's just really important to be thinking about regular hand washing alongside, as the person who's asked the question has rightly pointed out, alongside socially distancing, getting the vaccination, etc., etc. So just really to reiterate the importance of that common sense approach to touching surfaces and etc., and regularly washing hands and thinking that through, really.
Thanks, Sarah. That was really helpful. I presume I'll probably cover that one because that's a comprehensive response. So I'm just moving to the next question. And this is, so to ask a question about, will I need another vaccine for the Delta variant? So Christina, I don't know if you wanted to pick that one up. So what's the likelihood of another vaccine dose required?
Yeah, so currently it's two doses of the current vaccine are what everybody needs to get, and that is proving to be good protection. As Sarah mentioned earlier, we are anticipating that there will be a booster vaccine at some point, possibly an annual COVID vaccine, as we have a flu vaccine. This period is very important in giving us enough time to get those first vaccines out to the population, so that we've got the population protected and give science enough time to stay ahead, because certainly the pharmaceutical companies that make the vaccines and the scientists will be adapting the vaccinations to stay ahead of any future strains. But for this variant and any other variants to date, these vaccines are sound, and you need to get two of them. Thanks.
Yeah, thanks, Christina. Really good point. And I guess it's we'll pay tribute to our scientific colleagues out there who are constantly watching and testing what's happening around variants and thinking about how we might adapt if that's what we need to do. So we're very fortunate in this country to have some of the very best scientists in the world, and that certainly put us in a good position around vaccine, and I'm sure it will keep us in a good position as we move forward. So thank you for that. The next question is, and I'll maybe start on this. So are we going to have local contact tracing of people attending mass sport events? To be honest, we don't have that many mass sport events in North Somerset. That tends to be more of a Bristol thing. So I'll come to Christina in terms of major events maybe. But in terms of contact tracing, I suppose it's important to emphasise that in local authorities, we've done a lot of work in this space to build on the initial setting up of a national test and trace system. What we now have is a more local offer to be able to provide localised contact tracing. So that's local teams speaking to people. And we're finding that's having success in terms of being able to reach more people and follow through on more contacts, so to try and control the spread. So it would be more about contact tracing around a case and understanding what's happened with that case and where the exposures might be for that individual and whether those line up with any people, rather than routinely screening everyone who might have been in an event, because you would already have certain control measures going into that event that would try and risk the reduce of the virus spreading amongst that group anyway. So it's using contact tracing in the right space around the cases themselves. But maybe Christina, I don't know if there's anything you want to say, and certainly from Bristol point of view, you're a focus for large events and how you guys have been looking at that.
Yeah, I mean, it's a huge issue for Bristol on a number of fronts, and this applies to any large gatherings, theatres as well. These are all the events and that have been put on hold actually for the next 4 weeks. So there have been a number of pilots. It's been looked at very closely about how you bring people together for sporting events or into theatres, and how you do that safely. As Matt says, it's less about the contact tracing and more about the testing. So I would anticipate that when these mass venues open up, there will be a sort of an encouragement to test, lateral flow tests, and there will be COVID secure measures within the venues according to whatever the national situation is.
Thanks, Sarah. Do you want to come into there?
Yeah, I think I would just add the the learning from other pilots that has gone on across the country will certainly be applied to Bristol, North Somerset and South Gloucestershire. So as with everything COVID related, there's huge amounts of learning all the time, and we absolutely want to build on that and ensure we're not missing a trick. So I think it's really important that we will also be building on learning nationally.
Okay, thank you, Sarah. Okay, next question's an interesting one, which is, what is the current thinking about singing? And apart from being tempted to say there should be a special regulation to stop me doing it ever, I might come across to you, Sarah, if that's okay, just to anything we know about that and other activities that might risk spreading the virus. Thank you.
Thank you, Matt. I would firstly say I really do appreciate that for some people not being able to, and this doesn't apply to me by the way, but for some people being able to sing in groups is absolutely what keeps them going, and they enjoy doing it. And I have to say, same for me. Anyone in the vicinity of me singing would back off a mile. So I really do appreciate that for starters. I think it's starting to open up for some people. So certainly I know choirs in schools are opening up, and people are able to do small singing groups in bubbles in schools, for example, which is clearly great. And the wider guidance, I'm sure, will be changing rapidly for others in the population.
Thanks, Sarah. I have to say, I am a singer and I'm so missing our choir. And Bristol, I think, is famous, among other things, for having more community choirs per population than almost anywhere else in the country. So we are suffering. And of course, the reason that choirs were, stopped and asked to stop was because of the projection and the transmission risk, particularly from singing. And early on, there were some of the national choirs actually had some quite big outbreaks. As Sarah has said, things will come back. I know when we were between waves, some choirs were starting to sing outside. So meeting outside, singing outside, thinking about where your voice and where the projection is going to. Some places are using kind of shields, doing it in small groups. The other difficulty with choirs in the last few months has been that a lot of choir members are older and in the vulnerable groups. So that was also quite a risky place to be in an enclosed space with everybody singing. So many things will have changed, and most of those people will have, be vaccinated. You've got the testing, got the lateral flow tests, so choirs can make sure that you do that. Think about outside or spaces, tents or spaces where you've got lots of air going through big halls rather than small. And I'm with the rest of you, just looking forward to being able to get back singing again.
There we go. Thanks, Christine. There's obviously some learning that you can share with myself and Sarah in how to get into singing with a bit of skill. So we'll have to pick that up another time. Just going on to the next question, which maybe I'll come to you, Christina, to start off with. Perhaps quite a common frustration here. So it's someone who's saying that they work in a supermarket, but they're saying that people don't want to socially distance anymore. So why should I if they don't? Any thoughts on that?
That's a tough one, isn't it? I mean, that comes to the heart of the human condition. We are all in this together, and I think all we can do is do the right thing. We all have marshals and environmental health officers, enforcement officers who will come in and talk and help nudge and enforce. We don't want any confrontations over this, of course, but this has not gone away. Our case rates are rocketing in Bristol. We were up to a rate of 73 again this morning. We have increased 150% in a week. This is how this virus moves, very, very fast. A lot of it is asymptomatic. It hasn't gone away. It's in the supermarkets as much as it's anywhere. So we absolutely face space, but the space and keeping distance is one of the single most important things that you can do, and keep your face covered. So well done, and thank you for staying with it, everybody. If there are supermarkets or businesses who feel that customers are breaching, give the local authorities a call, and we'll get some people down there to help you out with that.
Thanks, Christina. Just checking, Sarah, anything more you want to say on that? Or
yeah, just to say, absolutely, really important for people to contact the local council, and we can support, as Christina says. Thank you.
Yeah, absolutely. And once again, thank you to everyone who's kind of keeping that going. We only do these things together. It just doesn't work as effectively if we split apart. So if you don't, if people are hesitating, even if you're not doing it for yourself, maybe do it for your family or for your neighbours, and think about what they might need, particularly those who are more vulnerable, because if there's any gaps open, the virus tends to find a way through, and we just don't want that to happen. So next question, which maybe I'll start off with and then throw it out to colleagues to also comment on. So it's a question about the safety of the AstraZeneca vaccine. So this, I think, has probably been in the light of some announcements following the approval of the vaccine to say that it would be more targeted at certain population groups. And I suppose I would take that as a comfort, because that's a sign of the scientists continually looking at the data and understanding what's going on as we're implementing a vaccination program. What we have had, of course, and it's been necessary in the response to a pandemic, is a very fast process of developing and rolling out vaccines, and that's made a huge difference, and we're very grateful for it. But as you go along, you will start to look at any issues of concern, and in the learning that's happened since the start of the vaccination program, that's flagged up the fact that the risk around the AstraZeneca vaccine, although it's low, there is a slightly elevated risk for the younger age groups. So we now have a different position where the under 14s are offered a choice around the vaccinations that they might want to take. They can still take it, it's no problems at all, but at least there's a bit more of a choice in there. So we've got more of a mix for that younger age group, whereas from 40 upwards, it was deemed to be, both very effective and very safe as well. So it's not that it isn't safe, it's just about trying to make sure you've got the right offer for the right population group, and we'll continue to learn that as we go along. And we've also talked about boosters, so the adaptation and the improvement around the vaccines to try and target the strains that are circulating will continue time after time. So it's not even like you've got a vaccine that stands still. It's constant adaptation to try and make it do the most effective job possible. So maybe there's a few points in there, but I'll hand over and see if anyone else wanted to come in and add a bit more input after me.
No, I think that's a really helpful answer, Matt. And I would just add, I guess, thank goodness for the science, because actually it's the science that's helping us out of this. And the vaccine programme has been incredible across Bristol, North Somerset and South Gloucestershire. And a huge thank you to those managing the programme, and a huge thank you to those of you who've come forward and responded to it. So absolutely fantastic and incredible effort. Thank you all.
Great, thank you, Sarah. So the next question is about indoor exercise groups for vulnerable people, and when do we think we'll be able to return to that type of approach? So not sure, maybe Christina, is there anything that you'd want to say on that? Is that something that's come up in Bristol as well from community groups?
Yes, it has indeed. I mean, indoor exercise, and indeed simply meeting, groups, community groups, support groups beginning to meet again. And so obviously we've got a slight pause now in the roadmap, and it's important we just note that pause. The reason for that pause is we've got widely circulating virus, and we need some more time to get the vaccine programme out. However, the roadmap will start to unfold, and as it starts to unfold, it will become possible again to start to meet in slightly larger groups inside. At the moment, it's still safer to meet outside, or certainly in a very well ventilated space, in smaller groups. So I think it's about understanding the risks and finding places and situations where you and your group can come together, can have that social contact and do your activities in a safe way. And again, all 3 local authorities represented here, if there are any community groups that need support with that, then contact us and we can talk to you about how we might support you. But it has been hugely tough. And I know the community groups and activities are really desperate to get going again. And you know, that will happen over the next few months, I'm sure.
Thanks, Christina. Just checking if there's anything more to say on that, but I think you put it really well in terms of it's about working with those groups and trying to maximise what we can do as we work our way through it. So thank you. So maybe come to you, Sarah. It's just a question in terms of thinking about COVID versus flu. So someone's commented here, Mike, saying he's had a flu jab for years and not limited normal activities. How does he judge when the risk from COVID reduces to no greater to the risk from flu? So maybe that's pointing towards how do we eventually try to live with COVID in some way?
Thank you. Yes, I think that's a really good question and one we're all aiming towards for sure. So this is about living with COVID and the future. And in terms of time frame for that, if we think about what's being planned out nationally, clearly we'll be looking towards reducing restrictions and living more post-COVID normal lives, you know, going into coming months, and that's great. And if we can then look also to a booster program for the COVID vaccination in the autumn, we can then start to really see how COVID and managing COVID starts to align very closely with flu. Now, clearly the science is guiding us on the timing of all of that, and the rates that we're living with are also guiding us on the timing of all of that. But clearly really important that that's where we're aiming towards. So good question, thank you.
Great, thanks, Sarah. Yep, it's a hard one to see all the way into the future, but something that we're definitely going to try and actively manage as we go along. So I'll maybe start on the next one, but I'll definitely offer for both of you to come in here because it's something that we'll all want to say, I'm sure, which is someone has commented, I've been helping in my local community over the last year. Can we get a shout out to volunteers? Well, it was something I was going to come to at the end and as part of the sort of wrap up for everybody. But yeah, I mean, massive thank you. Honestly, the truly inspirational way in which people have stepped forward and noticed what was needed in their community, and not just noticed, then gone and done some amazing things to befriend people, to offer practical support, to you know, step out into some challenging spaces at times, particularly at the start when we thought we were unsure sometimes about the level of risk and what might happen. People still wanted to step into that space and do the right thing. And there is no way that we would have got through this as we have. There's obviously been consequences and impacts, but you know, to still have a level of community support, a level of community working together to continue to adapt to the pandemic, that has been driven by people in our local communities, absolutely. And the agencies like local authorities and the NHS and everybody else, we couldn't have done it without the volunteers. There's absolutely no way. So North Somerset Together on my patch and everybody who's under that big umbrella, massive thank you to all of you. You've been stars all the way through, and something to celebrate out of what has been a very difficult year, 18 months, has been the way in which you've all stepped forward. So I'll stop there and I'll pass on to maybe Sarah. Do you want to come next and say your bit for South Gloss?
Yeah, thank you. And obviously, absolutely the same in South Gloucestershire. A huge thank you to everybody. And I guess what's really struck me, it's a couple of things really, is the innovation actually that's come out of all of this. It's people thinking laterally, people stepping out of their comfort zones often to help others and assist others, and think, as I say, think laterally around how they can really help out. And I think from a kind of individual perspective, all of us would also see there's been a real benefit in people stepping up and volunteering and supporting for our own local communities. We've sense, I'm sure all of us, a real enhanced sense of community now in our areas, and I can certainly sense that in South Gloucestershire and the communities within it. So a huge thank you to everybody. Thanks.
Yeah, absolutely. And Bristol has just been, as ever, magnificent, and continues to be, in every neighbourhood, in every ward, individuals looking after neighbours and vulnerable people, groups coming together when we've had to manage rising cases, getting the message out. Currently, lots of you supporting our pop-up vaccination programme, talking to people, getting people in, mobilising in the local parks. Community and volunteering has been absolutely the engine room of our response, and we would be nothing without it, nothing. So thank you.
That's good. Thank you for the opportunity to say that. Whoever put that question, I really appreciate it, because it has to be said loud and clear again and again, I think. And I know a lot of our local leaders have been saying that all the way through. So let's celebrate all the good work that's gone on. So next question, maybe if I come to you, Christina, is again a bit of forward gazing here. And the question is, do you think we will go back into lockdown this winter? That's a tough one for you. That's a tough one for the whole government, let alone you, but maybe give us your thoughts.
Yes, indeed. I think Boris Johnson is struggling with that one. I think nobody wants to go back into lockdown. You can hear Boris Johnson was saying that the other day. We are all feeling it. That's why this delay, this 4-week delay, has been put in place. However, we are dealing with something which is very unknown. This virus is only 18 months old. So about 18 months since we became aware of it. Within a year of it becoming, the world becoming aware of this new virus, science, as we've said, had managed to come up with a vaccine, but the virus is adapting and changing all the time, and continues to surprise us. We do know what we need to do. So I think my message would be, at some point the rules will come off, and that will enable us to get back to business, get back to normal activity. However, just because we can do something doesn't mean we have to do it. And I think if we move forward, we're going to need to get through the next winter and into the next spring before we really know that we've stabilised this. As we go into next winter, we will be dealing with the flus, we'll be dealing with COVID. So it may well be a very difficult winter, but if we want to avoid going back into lockdown, we all just have to continue to be cautious and careful, and not throw caution to the wind just because the rules come off.
Yeah, thanks, Christina. That's a good response. We've got to be measured all the way through on this, haven't we? And that's what's our best chance of a long-term recovery, which is important. So maybe, Sarah, if I come to you on the next one, which is probably a good opportunity for us just to restate some advice as cases go up. If you're told to isolate as a close contact, can you take a test and stop isolating?
So important to take a test, but continue to isolate. So I think it's really important that everyone has access to the latest guidance and maintains maintains the behaviours that are required in line with the guidance. And I think that also picks up on the point I was going to add to, actually, in relation to Christina's point. We all know now the tools that we need to get us through and to avoid future lockdowns. So let's continue to do that. Let's ensure we're all well versed on what the guidance is, test regularly, and get both doses of the vaccine.
Yeah, thanks, Sarah. Yeah, so it's really important that if you're contacted by your local contact tracing team or the national contact tracing team, that you follow their advice really carefully, If we all do that, then that is what limits the spread, and then we can get our arms around the spread of the infection and draw it in rather than see it run away from us. That's really important. So the next question, which I'll start with, and then happy to take comments from anyone else, is a question from someone who's saying, I own a small business and how do I get rapid tests for my staff? So I guess there's a number of ways that you can do that. So either individual staff can order it themselves and it can be delivered to their home, or they can go to pharmacies and collect one, or they can use one of our community testing sites that the local authorities run, where we're distributing lateral flow tests, and you can go onto the main council websites and you'll find some information quite quickly to guide you through the different options. Or indeed, a lot of employers are now having some tests delivered direct to them. It depends sometimes on the arrangement for your employer, but you can ask as a small business to join that scheme. So you can either run it yourself for your staff as an employer, or you can encourage your staff to pick up their own tests. And as long as they're doing them regularly and reporting the results, that will keep the intelligence flowing about whether there are any people who are unaware they've become COVID positive and pick it up through the lateral flow. So exactly the right thing to look for. Maybe talk to your staff and work out the best way of making sure that everybody's covered off and that twice a week testing takes place for everyone. That's the important bit. It's sticking with the behaviour, and then we don't have any gaps in terms of understanding the latest cases as they might present themselves. So I'll just pause there, see if there's anything else that anyone wanted to add to that.
Just to say thank you. That's great that people are thinking about these things. So great question, and thank you.
Yeah, and there's information on our website. We're saying there's information on our website, if you didn't take all that in, about where to get your lateral flow tests.
Yeah, thanks, Christina. So next one, if I come to you, Christina, to start off with, is a question from Paul asking, can we be sure taking all these tests is safe?
Interesting question. There's nothing inherently unsafe about taking the test. They're not very pleasant, that's what I'd say. They're nose and throat tests at the moment. So I think we're all hoping that as science develops, they'll develop something which is perhaps a saliva test, which might be a little bit easier. So they're not very pleasant, either the PCR or the LFD test, but there's nothing inherently risky about them. What is important about the lateral flow test is that it's a red light test, not a green light test. So the fact that you get a negative lateral flow test simply means that the test hasn't picked up any virus when you did the test. You still need to continue to use COVID safe behaviours when you're out and about. If you get a lateral flow test which is positive, you now take a second test, a PCR test, and that test is more sensitive. It goes off to the laboratory and it will confirm for sure whether you are COVID positive or not. So that's the only slight risk with lateral flow tests, that people need to understand. A negative test doesn't mean you are necessarily completely COVID free and that you can behave with abandon, shall we say. You still have to behave, move around with COVID safe behaviours.
Thanks, Christina. That's really helpful. And I think it's fairly comprehensive as well. Probably not much more we need to add on that. So I'll pick up the next question to start off with anyway, and it's asking about, are we now getting effective data from national agencies to enable effective management of outbreaks at local level? That's come in from Paul. I think what we would say is over the course of the pandemic, that's improved enormously in terms of being able to share data between national, regional and local systems. And as we said a bit earlier, we've now actually got some quite good local systems set up to support the contact tracing work, which is one of the key data flows, so we can understand who the cases are, how we speak to them and identify their contacts to be able to limit the spread. We work very closely with our colleagues in Public Health England, and I'd sort of say a big thank you to them for all of their support over the pandemic. We've got some really good colleagues, really skilled people who are supporting us. They've been supporting as well our settings, places like our care homes, our schools, our workplaces, where we've had clusters or outbreaks of cases. So the data is flowing. Some of that is numeric data, some of that is about sharing intelligence as well. And that's where local authorities, where we've had a bigger role in recent times, because often we're at the heart of knowing what's going on in our community. And I think that's helped us get to a better place. We've got people out and about in the community, people who can, as Christina said, go and visit. If there's an issue in a place, they can go in, have a conversation, make sure maybe that things are readjusted to make it safer. So it's a combination of information and data that is used. And at any one time, we try and draw on the different sources to get as good an overall picture of what's going on as possible, and then plan our next steps from there. And some of that might be about people who need to isolate, some of it might be about people needing to test, some of it might be about reaffirming advice to people coming in and out of that setting. It depends on the mix, but I think I would say that at the moment we're in a good place in terms of being able to get a good picture of what's going on. And that means we work closely with the settings themselves, places like workplaces, schools, care homes, wherever, faith settings, wherever it might be, where cases come up. It's all about having that conversation and then working out what's the best thing to do from there. So hopefully that gives you some assurance on that, but I'll open that up.
Yeah, thanks, Matt. I think that's a really helpful answer. I guess there's a couple of things I just to add, I guess, is a big thank you to our local trusted voices who work in our communities and collect some of that soft intelligence, and our local councillors and members. It's fantastic soft intelligence that we can then utilise, and thank you also to those of you who, as Matt was talking about earlier, who register your test results, because everything you're doing is then feeding the data that we have access to. So that's great. And also reassurance piece, I guess, in that within local authority public health teams, we are looking at the data on a daily basis, and that is so key to us understanding what's happening in our local areas. So an example being, we've seen an exponential rise in our rate in South Gloucestershire, as just reflecting on Christina's comment earlier too, and we're seeing the same in North Somerset. So it's important for us to see what is happening on a daily basis and act when we see our numbers go up. So we do need to be responding to that data and acting on it swiftly. Thanks.
Just to add, I think possibly the source of that question was that at the beginning of the pandemic, there were issues about local authority directors of public health having access to data. I would say that has been resolved. We do get access to all of the data in a very timely manner, including access to the NHS vaccination data. So we're very well sited now in a way that we weren't quite so cited going back a year. So yeah, great improvement.
Yeah, and I think it's probably just worth reflecting that, again, things were happening so fast, so many systems were set up, so much response all happened at once. It was difficult to connect all those things together, but there's been a concerted effort. So, it's good to get to this point where we have that more comprehensive view of what's going on. So the next question, maybe Sarah, if I could come to you. I think it's quite a hard one to ask in a general way, but it's asking, when will decisions be made about going back into offices for work? I think that's quite a varied picture, but maybe if you want to start, that'd be great.
That's almost quite a philosophical question, isn't it, in terms of the future of our of how our society will operate? But I'll try and avoid getting into that. I think there's guidance there. There are some businesses and companies that are starting to open up, and staff are going in. So I think there may well be a varied approach to this going forward, but clearly now all businesses need to be operating in line with the national guidance, and obviously the delay in the roadmap may well impact on specific companies and businesses. But I think clearly there'll be a look at by individual businesses in terms of how they want to operate going forwards, and that's going to be something for people to be keeping a close eye on, I think.
Thanks, Sarah. I think that covered it very well. Just checking to see if there's anything else, but probably that's as much as we can say at the moment. It's quite a varied world, a whole thought about offices and what we all might do in individual circumstances. Christine, maybe if I could come to you with the next question, which is a question about accessibility. So this is can we make the information more accessible for people who have learning disabilities? Not quite sure which bit of information that is, but maybe just in general, picking up the point about how we make sure that everybody can access the right information.
I think that's a very good general point. And in fact, I had to access some NHS information yesterday for some colleagues, which was in relation to the NHS Health Inequality Plan. And there were about 4 or 5 quite dense documents, and the one that I read actually was the easy read version. So I think there is a principle about accessibility, both in terms of written information or verbal information, but also about physical access, that actually we all benefit if we get this right. I think that the pace that we have had to move with COVID has meant that probably we haven't got this quite in the space that it could or needs to be. And certainly I think working with some of our local learning disability partnerships would be really beneficial to all of us. I'd invite you to do some mystery shopping. Let us have some feedback, and if there are any groups who work on easy read or have those sort of skills, please come forward. Our comms teams are all looking in here, and I know have been working very hard on this, but yeah, absolutely could do better and should do better, and we can build back better actually by starting to build this in now.
Yeah, thank you. And any other thing I'd say is if there's a specific example that you have there about some of the information that's not been available in the right format, then do contact your local authority and raise it through us, and then we can see what we can do to try and help that, whether that's local authority or NHS information. We can do what we can to try and improve that situation. But thank you for raising a really important point. Okay, so the next question, which maybe I'll start off and then see how colleagues want to come in. So it's a statement from somebody saying they can't book their second vaccine, and they're asking, should I wait 8 or 12 weeks following the announcement last night? So I guess the key thing is around your second vaccine, if you've had the first, you should be getting an invitation to book your second. So that should come through automatically, either through possibly your local GP practice or the main site that your GP practice uses, or through the main vaccination centre at Ashton Gate. So whatever way you use to book the first vaccine, you should automatically be invited at the right time to come forward for your vaccine, be sent a link, and then you can book your slot in from there. So from personal experience, as soon as that popped up, I got straight on it and booked my second jab as quickly as I could. So I think that's the key behaviour that we're looking for. So don't worry, you will get contacted at the right time based on the position. I don't know if anyone else wanted to add anything to that. Happy with that as a overall approach?
I think that's correct, and that it's an automatic process. That once you book your second, the first vaccine, the second one should follow.
Okay, thanks, Christina. The next question, which may have been posted before we covered some of the other areas, so this is about booster jabs, and I think we indicated that that's something that's being looked at from the autumn onwards as a potentially important next step in providing additional protection as we move forward. So I think the answer is potentially yes, but we'll wait for more detail based on national guidance on that one, and then we will most definitely support that through local action if that's what we need to do. So next question is, maybe Sarah, if I come to you on this one, it's a school-based question. So someone's saying, my child's school has today advised she wear a face mask again from tomorrow. Is homeschooling likely again, and is she safe at school? So that's probably 3 questions, one about the mask, one about homeschooling, and one about being safe at school.
Thank you, and that's a really good question to be asking. I mean, in terms of safety and the management of any outbreaks in schools, safety is paramount in relation to staff and students. So I would envisage that what you've just described is the outcome of an outbreak control team meeting, which would have involved key people from the school, from Public Health England, from local authority public health teams, to really review what's happening in a school, risk assess, so determine whether bringing in and reintroducing mask wearing will be of benefit in controlling the spread of the virus and managing the situation in the school. So that would be the process that would have been in place. It doesn't automatically mean that your daughter will then have to revert back to homeschooling. This is an initial step to try and contain and manage. Now, clearly, I don't know the exact situation. I don't know the school that's being described, but in terms of overall process, I hope that's reassuring. And as I said at the start, these decisions are never taken lightly, because I do completely appreciate the difficulty this is for children and staff to have to go backwards in a sense. So really do appreciate that, and that's a helpful question. Thank you.
Yeah, just check, was there anything you wanted to add with that, Christina, about the kind of approach with schools and safety at school and how we work on that?
And no, just to reiterate, you thanked the schools, teachers and school leaders and staff. They have been exemplary under extremely challenging circumstances to create safe zones and bubbles. And I think all incidents and outbreaks have been really well managed. It is very disruptive. It's disruptive for the schools, for the students, for the staff. But actually, in Bristol at the moment, in spite of these rocketing rates, actually we've got less than 100 people in schools, students and staff, who are positive, and those are spread across 25 settings from secondary, primary, early years and FE. Now, what happens is that's much more disruptive than those smallish numbers would indicate, because you have the whole bubble, or it might be a big bubble, goes home. But in terms of the safety of children, we know that children being in school, being with their peers, getting back to learning, socialising is as important as, extremely important. And if we need to keep those settings open as much as we can. So I think going back to any sort of lockdown of schools or closure of schools would be absolutely a last resort.
I think I would just perhaps add as well, just thinking about the person that's asked the question, a big thank you to parents in terms of their adaptability and flexibility, because I know none of this is easy. So thank you.
Yeah, absolutely. Really challenging on many levels, isn't it? When if you're working from home and then you're homeschooling, and all of the logistics and trying to keep family life going is no mean feat at all. So thank you to everyone who's worked their way through that. So we're almost coming to the end now, so we've got time for just the last couple of questions. Maybe Christina, if I could start with you on the next one, which is just a question about, will my child get the vaccine? So maybe the latest thinking on where we are with that.
Yeah, so we're waiting to hear on that. The vaccination programme is going to go down to 18 plus very shortly. We're currently at 25 plus. It will go down to 18 plus shortly, which will be very important, because a large number of cases are in that 20 to 30 age group. That's the group who are socialising, who need to socialise, want to socialise. So that will be very helpful. So the decision about a children's vaccination programme will be taken by the Joint Committee for Vaccination and Immunisation, and they're looking at it very closely. I'm not aware that we've had any information. I don't know if I've missed anything, colleagues, but I don't think, no, we've not had anything come out. So we're waiting to hear, and that, I imagine, will be administered through the childhood immunisation and vaccination programme, along with all the other childhood immunisations that we have.
Yeah, thanks, Christina. So yeah, I think the point is that's very much a national decision, and as and when that decision is taken, then we'll work with local stakeholders, particularly our NHS colleagues and our local NHS providers, to make sure that things happen smoothly if that's what's required. So the last question is about, will we be able to identify sources of outbreaks as restrictions relax? Things like sporting events, nightclubs, holidays overseas, university returns, etc., and act on that. So maybe just as a summary, I'd say, well, we'll go back to maybe some comments we made earlier about the different sources of information that we now have access to, the intelligence that we gather. So we can see the individual cases. We have information about those cases, about where what we call common exposures are, so where those people may have been and where they may have been in contact with other people, and where groups of cases are clustering around a particular venue or a particular event or whatever it might be. So yes, we will use all of that data to understand what's going on, where the relative risk is, and then try and take targeted action to address that. And that might be through additional testing, that might be about additional advice in those settings, or then working our way through the contacts of those individual cases and making sure that they're isolating appropriately and understanding any further risk there might be from those individuals too. So it's the constant detective work that is done in public health. We've been doing it for some time now, and we'll continue to do that because we take our responsibility really seriously about trying to limit the spread of infection. So I don't know if colleagues wanted to add anything to that.
No, that's great, Matt. I think it's really important that all of us will be building on the skills that have been developed over the last 18 months, and just to reassure that despite restrictions relaxing in the hopefully not too distant future, we will continue to support our local communities and do the right thing at the right time.
Yes, and probably just to add that this is back to business as usual in terms of managing communicable disease. And we're very fortunate in the UK in that we've got some of the most advanced public health systems in the world, of which your local public health teams, which Matt, Sarah and I represent, are one part. We work very closely with Public Health England and what will become shortly the UK Health Security Agency in the management of those outbreaks. And they happen all the time, communicable disease incidents, clusters and outbreaks. When it's not COVID, that just happens very seamlessly. So we will continue to do that as business as usual, and we'll be, as I say, working with the UK Health Security Agency, who's been set up specifically to make sure that we raise the bar even higher.
Thanks, Christina. That's probably a nice summary for us to end on, because that's hopefully a bit of reassurance around the ongoing work that will take us forward over the next few months, making the best use of all the skills and resources that we have in the public health system. And maybe just to finish with, again, echoing the thanks to all of our colleagues who have worked so hard to make sure that we've limited the damage of the pandemic as much as we can, to our communities out there who have responded magnificently through all of the different asks, whether that's been about testing or isolating or stepping forward as volunteers or just good neighbours to people in their community. So thank you for all you've done so far. Please stay with us over the next while. We're doing really well, and we're getting to a much better place with the vaccination coverage, and we will continue to work with you. So if at any point you want to ask questions, do come forward, use the websites for each of our local authorities, put forward a question, and we'll try and pick that up and work with you to address any concerns that you have. But for now, we'll probably end there. Just a massive thank you from us for all the questions. It's been a really interesting and helpful session this evening. I'm glad we've done it, and we'll look again to maybe try and do something like this in the future. But for now, thank you, and I hope you all have a good evening.